So by no means am I an expert on transportation, but over the last year, we have a working group working together. So I'm just going to be providing you with some information about what our work group has done over the last year and hopefully answer any questions that you have, but also refer back to the experts that are in the field of transportation, some of which are in the room. So like was mentioned, my name is Taylor Matson. I'm a community health promoter at the North Bay Parry Sound District Health Unit. And within my portfolio at the health unit, I work with the healthy aging and the Stay on Your Feet falls prevention portfolio. I was the previous chair of the Nipissing Parry Sound Transportation Working Group that was formed. And today, like I mentioned, I'll be here just to talk to you about some of the accomplishments that the group has had over the last 10 months, almost a year now. So I'm just going to walk you through a bit of a timeline of where our group came from and what our next steps are. So transportation was identified as a priority from many of our partners involved in the Nipissing Parry Sound Stay on Your Feet Coalition, as well as the Village's Steering Committee. So in January 2023, we actively recruited individuals who might be interested in joining this working group, whether they were involved in offering transportation services throughout our districts, or maybe were a service provider that was looking for increased access for their clients. So in March 2023, we had our first meeting, and then we began to develop our reference our group. So the vision of this working group was that the public and service providers in Nipissing and Parry Sound districts are aware of transportation services available, including inclusive and accessible options. The mission of our group was to work collaboratively to promote transportation services in Nipissing and Parry Sound districts and support increasing the capacity of existing services. Our group identified 6 goals that they wanted to work towards. The first one being increase awareness of existing transportation services in the Nipissing and Parry Sound districts, identifying gaps in those services, for example, whether they're geographical gaps or accessibility gaps, and present this information in digestible ways. We're looking to work collaboratively to increase the capacity of existing services, maintain an up-to-date inventory of transportation services. I know we always talk about as soon as you have an inventory, as soon as you print it, it's out of date, but it's important as a first starting point to at least know what's out there. Share information pertaining to grants and training opportunities with interested organizations, that being more specific with the transportation services, as well as advocate for age-friendly transportation services. So the working group meets virtually once a month to try and support meeting these goals. So in the spring of 2023, Leah Jane Curry was a Master's of Social Service student at our health unit and was doing a placement with us. It was really, really helpful that we had a student at that time to help us really work on this. One of Leah Jane's projects during this placement was to complete an environmental scan of all transportation services in the Nipissing and Parry Sound districts and develop an inventory to share this information in digestible ways. So a form was developed to support the environmental scan. Leah Jane contacted each transportation service and either sent them the form to complete or completed it with them on the phone. We looked at getting operational information, eligibility, geographical boundaries, registration processes, cost of services, the type of transportation service. So for example, if it's for medical appointments only, do they support transportation to go to social activities? Is the service curb to curb or door to door? Trying to get a full inventory of what exactly these services offered. So this information was then collated and to develop a comprehensive inventory, and as well as just assess the gaps or the various levels of services in our communities. So finally, in October 2023, We had a finalized inventory and we've been able to share it widely. So I'm just going to show you what that looks like. I also brought in copies. I didn't know where to put them. So at the end, if you're interested in taking a physical copy, I'll also talk about where you can find it online, or you can always email me. You're welcome to take this home. So this is an example of page 1 of the inventory. So services were arranged into Nipissing and Parry Sound districts. So one of the pages was for Nipissing, the other front and back was for Parry Sound. Contact information and hours of service was included for each service, because that's something that people would like to know. Eligibility and service location was also included to ensure that individuals or service providers could determine which services were most appropriate for them or their clients. And then finally, information pertaining to what type of transportation the organization offered. So for example, if it was primarily just for medical appointments, or if they offered transportation for a lot of other different means, was included in there as well. As well as we identified if that organization had an accessible vehicle. So I'm not going to go over every service with you, but I have the resource here for you to take home. And so here's just the example of page 2 of the Nipissing inventory. We wanted to include taxi and public transit to give a whole comprehensive idea of what types of transportation. Here's some of the specialized transportations, and here's some more publicly accessible transportation. So you'll notice on this inventory, information pertaining to costs or wait times was not included, as this information was subject to change. We have that information, we're just not putting it on the inventory. It'd also make this inventory like 100 pages long if we had that. The working group also determined that the goal of the inventory was to provide individuals with enough information to prompt them to contact the organization and learn more about how to access the service, because those organizations might be able to work with the client to overcome maybe some barriers with accessibility. So here you can see the same inventory for Parry Sound. I won't go over it in depth, but it's the same thing front and back for the services in those communities. So we've been distributing the inventory over the last 4 or 5 months. It's an ongoing process, but just wanted to share some of the ways that we've been currently promoting the resource. So working group members have been sharing this resource at diverse tables that they sit at. We're sharing it also just through our networks in general. The health unit shared a post promoting this resource through our Facebook page back in November, I believe it was, and received incredible engagement from it. We had over 130 shares and over 4,000 people clicked on the link to look at the resource. So you can see that this is a topic area that people are interested in just by the engagement on our Facebook posts that don't always get that type of engagement. It's also found on our health unit website under our healthy aging page. You just go to myhealthunit.ca/SOYF, stay on your feet. It can be found on that page. And I believe also the Ontario Health Team is or has put it onto their website as well. And then finally, we've been sharing at various events like this one today to try and increase the awareness of this resource. Just some key take-home messages from conducting this environmental scan, things that the working group had discussed or learned throughout the process, is that there is a cost associated with all transportation services. There's no such thing, for the most part, maybe there is, but what we saw, there was no such thing as free transportation. Individuals are encouraged to contact the organizations as they might be able to support that individual in some different options. Next is just ensuring that awareness of all service is done on an ongoing process. I had a really good meeting with a transportation service outside of our district, but just learning about funding opportunities that they had access to increase their capacity. And they said every 2 months they go out and paper the town. They said that no one remembers about their transportation service, but every 2 months they paper the town, they put up posters all over the place, and then they get tons of referrals. So it's an ongoing process. You can't just do it once. All communities in our region, they are serviced, surprisingly, but at different levels. And so we're right now kind of looking at the data that we have to see how we can support with advocacy for that. And as well, accessible options are needed in all communities. And again, that is on a varying level for that. So moving forward with the working group, we're looking at kind of pivoting our focus of the group to promote and encourage volunteerism, as volunteers are the driving force of majority of these services. So the group is currently looking at developing a campaign for National Volunteer Week that happens in April. To highlight the health benefits of volunteering and promote ways that individuals can volunteer in Nipissing and Parry Sound districts. So if anyone is interested in being involved in that campaign, this is my little pitch, please feel free to reach out to me and I can give you more information. And I just wanted to thank members of the Transportation Working Group for all of their work over the last 10 months. And then my contact information is here if you have any questions about transportation or really anything falls prevention or healthy aging. Thank you.